Yeah, I think one of the unique attributes about COVID with respect to medicine and certainly spine in general is certainly being here in New York City. We were really the tip of the spear when this really hit the US in March and April. And New York Presbyterian, really took care of about 70% of all the COVID patients in the New York City and surrounding area. So we had significantly high numbers, and it obviously completely changed how we practiced at the time. And all the surgeries that we had for basically about 2 to 2.5 months were canceled or delayed for safety concerns and other things. But once we really started back up in June, and then certainly July, when we got back to essentially full strength from performing surgeries and seeing patients again, we saw a couple different things. Certainly the way I look at patients that are going to undergo surgery or who have conditions is it really is based upon their symptoms. And so oftentimes we see x-rays and MRIs and they look significant. Someone has very bad arthritis or very bad pinching of the nerves or stenosis, but if they don't have symptoms, then they don't need surgery. And so I think we've seen a little bit, maybe 60 to 70% of people, their symptoms really didn't change, but then 10 or 15% got much better because they weren't being as active during those 2 to 3 months, or because they weren't commuting, or because they weren't able to go to the gym. But then we also saw 10 to 15% of people get much worse because they were sitting a lot more and in much more uncomfortable positions, and also weren't as active and weren't working out as much. So I think it's really affected everything really on both sides of the aisle. And now that we're essentially back to 100% capacity in terms of our volume, we're still continuing to see some lingering effects. And oftentimes, now we're getting COVID tests on everyone. That's a requirement to undergo surgery. But part of the inflammatory condition is some patients, once again, that 10 to 15% really actually got much worse as a result of the process, but also because of the big change in lifestyle. And I think we'll continue to see that because more and more of us are now sitting behind computers, things that we realized or didn't think were that compatible before, like telehealth. We do that's a routine part of our practice. And now it's so much easier to go on a Zoom and speak to a patient, but look at them live and go over their imaging studies and things like that. So it makes it safer for them in terms of COVID, but I think it also helps us understand and appreciate more of what's going on. And then we get to see them in their home environment, right? And so I think that's one thing that maybe COVID has really transformed now how we're, not just how the rest of the population at large is going to live, but also in terms of how we provide good spine care and spine healthcare moving forward as well.